Hello doctors, welcome back to Dogshala. In this series of video of NEET MDS 2021 recall, we are going to see about pterygomandibular space infection from the subject oral and maxillofacial surgery. So the question they have asked in the previous exam was, it was a clinical question. So a patient with an infected lower molar presents with fever and tachycardia. Okay, so the patient presents with fever and tachycardia. Tachycardia is nothing but increase in heart rate. So also complains of difficulty in breathing and swallowing and has pain on opening the mouth. Okay, so he has pain on opening mouth, has difficulty in breathing and swallowing. So on examination, we see a swelling around the soft palate with uvula deflected to the opposite side. Okay, swelling on pharyngeal slits is visible with dysphagia. Okay, the most probable space infection involved is, and the options given were submandibular, pterygomandibular, temporal and buccal. Okay, so these were the options that they have given. So let us see the pterygomandibular space anatomic location first. Okay, so here you can observe the image here. So here there is the pterygomandibular space that is located here. So this space is the pterygomandibular space. So let us see the anatomic location. So it is located between the medial surface of ramus of mandible. So this is the ramus of mandible and lateral surface of medial pterygoid muscle. So the medial surface of ramus of mandible and lateral surface of medial pterygoid muscle. So this is the space. So it is limited superiorly by lateral pterygoid. So it is limited superiorly by lateral pterygoid. Okay, so this is the lateral pterygoid. It is superiorly it is by the lateral pterygoid. Okay, so it separates the space from the infratemporal space. Okay, so it separates the space from the infratemporal space. Okay, so what all it contains? It contains inferior alveolar neurovascular bundle, lingual nerve and chorda tympani. Okay, then coming to the signs and symptoms which we see when we have a pterygomandibular space infection are, so here you can see the image. So in this there is moderate or severe trismus. What is trismus? Difficulty to open the mouth. So difficulty to open mouth is known as trismus. So there is limited mouth opening. Then moderate swelling of the tonsillar pillar medially. So tonsillar pillar moderately it is swelled. You can even observe that in the image also. Okay, and tenderness over medial aspect of the mandible. So that cannot be elicited in severe trismus. Of course, if when there is severe trismus, there is difficulty in opening, we can't see the mandible clinically, right? So that is why it cannot be seen when there is severe trismus, but when there is moderate trismus, we can appreciate the tenderness over medial aspect of the mandible. Then dysphagia. Dysphagia is nothing but difficulty in swallowing. Okay, difficulty in swallowing is seen in pterygomandibular space infection, and the midline of palate is displaced to the unaffected side. Okay, so this is the affected side. The midline of the palate is displaced to unaffected side. We can't see it here in this image, but just remember this. Then there is swollen uvula. So you can see that in this image, the uvula is here is swollen. Then there will be difficulty in breathing to the patient. So these are the important signs and symptoms that we see in pterygomandibular space infection. Then what is the odontogenic origin of this infection? So we know there is a pterygomandibular space that is associated with the mandible area, right? So what will be the odontogenic origin? So as given in the image, you can appreciate here there is pericoronitis of the third molar. So this is one of the reasons why we get a pterygomandibular space infection. Pericoronitis associated with unerupted mandibular third molar, and also contaminated needle usage. Okay, or injection site not disinfected prior to infection. So here is the space we give a lot of injections for blocking the nerves like mandibular nerve and all. So when we are using contaminated needle in this site, there is also a possibility of getting a pterygomandibular space infection and also mandibular second molar infections. Okay, so this is the reasons. Then coming to the patterns of spread. So the spread, how does the infection spread in the pterygomandibular to the pterygomandibular space? Let us see that. So superiorly from pterygomandibular space, it goes into the temporal spaces, okay, and anteromedially and then posteriorly towards the parapharyngeal space. So here is the parapharyngeal space. So from pterygomandibular space, anteriorly and posteriorly it goes to parapharyngeal space, and anteriorly and laterally it involves buccal space and submasseteric spaces. Okay, so this is the submasseteric space and this is the buccal space. Okay, it involves buccal and submasseteric space. Then anteriorly it involves infratemporal space. We can see this in this image. And anteriorly and inferiorly it involves submandibular space. Okay, so this is how the spread of the infection is seen in pterygomandibular space infections. Then coming back to the question. So what they have asked? So they have asked, basically when you are given a clinical question, please keep in mind that you need to check with every point, like every sign and symptom that he has given, so as to arrive to the answer. Okay, so the patient with a lower infected molar. So lower infected molar, what all the spaces that are associated with lower infected molar? Submandibular, pterygomandibular and buccal, right? Temporal is ruled out here itself. Okay, so presence with fever and tachycardia, these are not of such importance. Also complaints of difficulty in breathing and swallowing. Okay, and has pain on opening mouth. Okay, so when there is difficulty in breathing and swallowing, that means the pharyngeal spaces are involved. Okay, the pharyngeal spaces are involved. So pharyngeal spaces most commonly are involved in pterygomandibular and also in submandibular also. Okay, then on there is pain on opening mouth. So when will there be pain on opening mouth? When there is involvement of the angle of mandibles. Okay, angle of mandible, when there is involvement, there will be pain on opening the mouth. So that we can see in pterygomandibular and buccal, right? So from this we can rule out submandibular partially, right? So on examination, a swelling is seen around soft palate with uvula deflected to the opposite side. So uvula is deflected to the opposite side. During buccal infection, buccal space infection, there is no harm to uvula. Okay, it is seen only in pterygomandibular space. So swelling on pharyngeal slits is visible with dysphagia. So he has also given one more clue, dysphagia. Dysphagia is seen in pterygomandibular space infections, which we have seen it in the signs and symptoms of the space infection. So the answer for this question will be pterygomandibular space. So this is one of the way you can arrive to the answer for this question. Okay, hope you like our video. Do subscribe to our YouTube channel for more such videos, and you can also follow us on Instagram at Dogshala for dental content and at Dogshala Medical for medical content. You can also find us on Telegram. Thank you.